For joining us today. I'd like to welcome you to our webinar, Driver Health in 2012, What It Means for Your Fleet. My name is Hannah Kroom. I'm the Senior Online Marketing Manager at Comdata, and on behalf of Comdata, I'd like to thank you for taking the time to attend today's event. In the studio with me today is Bob Ternius, Vice President at Comdata, and we're excited to hear from our two industry experts on driver health, particularly sleep health and driver fatigue solutions. Please join me in welcoming Evan Bledsoe, Executive Vice President at Sleep Access, and Gary Kerrigan, Director at Sleep Access. Before we get going, I'd like to share with you a few quick housekeeping notes. We will have a Q&A session at the end of today's discussion. You can feel free to ask questions to any of today's speakers. Because of the number of attendees we have joining us today, we'll take your questions online at any time throughout the discussion, but we'll save responses from speakers until the end of today's presentation. To ask a question, click the arrow on the right side of your screen to open the control panel, select the Question and Answer tab, and type your question into the box. Hit send, we'll receive it on this end, and then again we'll be able to respond to all questions at the end of today's session. Again, you can submit a question at any time throughout the presentation. Bob, if you are ready, I'd love to turn the discussion over to you.
Thank you, Hannah. Today we'll discuss several topics and issues impacting the transportation industry, with particular focus around driver health and wellness. Let's take a quick look at the agenda. We're going to talk about highway bill that's in there now, the CSA, compliance, safety, and accountability, driver health and wellness specifically, the FMCSA, sleep health, and then followed up with a Q&A. First, let's look at the highway bill. It's a major source for highway funding for interstate and public transit programs. It's the largest pending jobs bill in an election year, so politics will play a large role in moving the highway bill forward. The last bill had a 5-year term. There have been 10 extensions since September 2009, each 2 years long. So there really has not been a solid highway bill other than extensions for the past 3 years. The projections on the annualized spend currently is $75 to $100 billion. And finally, there's a $12 billion funding gap between the current spending and the money in the Highway Trust Fund. So there's definitely a revenue shortfall there. So when do we think it's going to pass? The current version runs out in June of 2012. The Senate has passed a 2-year extension. The total spend approximate is $109 billion for that period. In the extension is a key initiative that is supported by the ATA mandating electronic onboard recorders, or commonly known as EOBRs. The House is considering the extension currently, and of note, in the House's discussions, there are no references at all to the EOBR mandate. So it's still a contentious item out there, issue, the EOBRs, and really it's around what is now being termed as driver harassment. And we'll get into that a little bit later. So what's in the highway bill at a high level? The EOBR issue. The ATA supports the mandate within 1 year after passage for all interstate and passenger bus drivers. The Owner-Operator Independent Drivers Association, commonly referred to as OIDA, is contesting the mandate. And again, what they're charging is it's infringing on the driver's ability to operate the truck safely. It's harassing the driver because there is the ability for constant communication in the cab. Hours of service, the primary issue there is the 34-hour restart changes that are proposed. Carriers, and again ATA, vehemently state that it reduces their productivity, the ability to drive. Finally, a project that's big in the highway bill is called the Keystone Pipeline Project. Again, the House wants this built starting in Canada and being delivered to the Gulf refineries in Texas. Currently, the Obama administration and various environmentalist groups are opposed. One question that's being asked is, where will the funding come from when there's a revenue shortfall already known? There are thousands of jobs to be created if the Keystone Pipeline project is approved. In this political year, again, that's going to come into play, and we'll take the results. Let's next look at the highway bill specifically, and the electronic onboard recorders, also known as EOBRs. As noted, the ATA wants EOBRs mandated for all interstate and passenger bus drivers 1 year after passage. Again, OIDA has filed suit against the August ruling, claiming that the EOBRs are a tool for driver harassment. It's interesting that EOBR manufacturers are now fearing that changes in the specs of the units to address driver harassment issues will add cost to their product. And again, it's somehow they're going to have to determine how to limit the constant communication ability of the EOBR between the carrier and the driver. What's the impact of the EOBR? We like to think, and from carriers that we talk to, primarily the position held by company fleets, they think it does increase driver satisfaction. Owner-operator fleets, they do agree that data accuracy has improved tremendously. But again, they don't like the constant communication and the driver harassment. No one can dispute that there's less paperwork for drivers. In the hours of service and fuel tax processes, EOBRs remove the tedious task of completing logs and driver trip reports. Please note that on the fuel tax side, auditors are willing to accept EOBRs. However, they do want to see odometer data from either the engine control module, commonly referred to as ECM, or the actual odometer. The FMCSA and the National Transportation Safety Board, NTSB, have claimed that there is overall improvement in CSA scores and reduction in accidents. Interestingly, on May 15th, there's an op-ed in the most current Transport Topics, and that op-ed is refuting the FMCSA and NTSB claims. So the jury is out. The statistical data is still being compiled. The final question along the EOBR line, does it help retain drivers? We found that it really depends who you're asking. Again, a company fleet or a group of owner-operators will have different opinions. For the most part, company and private fleets, again, support the EOBRs and believe they do help retain drivers. Most owner-operator fleets don't share that thought process. The overriding issue, again, is driver harassment and the ability for constant communication with the driver. On the bright side, the cost of the EOBRs continue to come down. Currently, there are models priced around approximately $500, whereas 3 years ago, comparable models were in the $200 to $2,500 range. This gets us ready for our first poll question. Do you currently utilize EOBRs? A few of the EOBR manufacturers that are out in the market, the leaders are Qualcomm, PeopleNet, and Zeta.
So Bob, it looks like we're getting some interesting results, and it looks like we're just about even with people who do currently use EOBRs and people who don't currently utilize EOBRs. So I'm going to go ahead and share these results with everyone right now.
That's interesting. I would think that those numbers, as far as those that are utilizing EOBRs, continues to grow. It looks like we've got a good blend of probably company and owner-operator fleets on the line with us. What is an EOBR? We'll answer that. Electronic onboard recording device. Okay. So that's good input. Okay, next we want to discuss the Compliance, Safety, and Accountability Program, commonly known as CSA. It was launched in the late 2010, 2011 early as a highway safety initiative. In today's presentation, we're focused on two what are called basics, or behavior analysis and safety improvement categories. The first basic is driver fitness, and the second basic is fatigue driving. We'll get into those in detail later in the presentation. The Safety Measurement System, also known as SMS, has replaced SafeStat and is focused on the carrier and driver and safety. Approximately 20% of the drivers that have exited this business over the past year and a half are a direct result of coming into compliance with CSA. The driver pool is shrinking. To compound that, demand is growing. As the economy continues to grow, carriers are in constant need of capacity. As a result, carriers are reporting a 20 to 30% increase in year-over-year brokerage activity. In some cases, brokering freight saves the carrier expense in the areas of fuel and lower insurance requirements. Approximately 65% of the carriers are now conforming to CSA. The general consensus is that CSA is working. A large percent of form and manner and incorrect record of duty status basic violations go away with EOBRs. One last item around conformity here, and some current news, carriers are voicing concern and taking issue with the crash basic as it relates to fault in crashes. Currently, there is no way that a carrier can, if a shipper or the public or anyone wants to go on SMS and look at scores, then the crashes, it just shows that carriers are involved in crashes. And what the carrier wants is they want to have the ability to have a no fault posted on a crash. The plaintiff's attorneys are fighting that, but it seems logical that if they're not at fault, it should be posted on the website. Also, the shippers are now looking into carrier CSA scores. As a matter of fact, I just got a Transport Topics email where the FMCSA is stating that within 5 years, they want to expand its reach to include shippers. And that will be something different. I mean, the shippers are in the market now, or not in the market, but in the CSA space. But if the FMCSA gets in to regulate that, that will make a difference. Our next poll question is, what is your average driver age? In my conversations with carriers and drivers, my thought is 45 to 60 years old. And we'll see if I was taking good notes during the meetings.
So Bob, I will show these results, give people just a couple more minutes to, or minutes, gosh, a couple more seconds to respond to this poll, but I'll share these results in just a second. It looks like you're in the right ballpark there, but we're pretty heavily weighted towards 35 to 50 years of age for average driver age.
Okay. And
Here we go.
Yeah.
Here we go.
Yeah, that's interesting and telling in the industry, I believe, that we need to get the 25 to 34-year-old demographic in this business as drivers. That's very telling. Okay, let's move on. And a couple of facts and numbers around driver health and wellness. Found it interesting, and you need to step back every once in a while. The transportation, trucking side of transportation, $600 billion in revenue in 2011. There are approximately 3 million drivers, 1.2 million carriers, and 97% of the fleets are made up of less than 20 trucks. So there are a lot of small, of the 1.2 million carriers, a lot of less than 20 carriers out there. One aspect of concern is the driver turnover. On average, fleets see 80% or more of annual driver turnover. These are generally accepted industry numbers that support this. Within that 80%, 50% of the drivers will have zero turnover. This is the driver base that has longevity and tenure. They understand the carrier, understand the dispatching system, all the nuances of that carrier. So that 50% of the 100 drivers, if you will, they are constant. The second set, 25%, they have a 20% turnover. This group is relatively stable. The last section, the 25% of the drivers with 300% turnover, that's the bottom 25 that move to a different carrier for almost anything, including a small sign-on bonus or a penny per mile increase in pay. They are constantly churning and looking for the next best financial opportunity. Most likely, they will move within the initial 90 to 120 days after hiring on with the carrier. Working with the same 80% annual turnover rate, let's assume a fleet of 100 drivers. There are two significant costs here to highlight. First, just the straight hiring and training cost per driver has been calculated at approximately $4,000 per driver. So to maintain a full fleet, an annualized cost is $320,000 to the carrier. That's significant. Even more significant is each driver represents $100,000 of revenue annually per carrier. So if you take the 80 drivers at $100,000 revenue per driver, that's an $8 million lost revenue opportunity. And if you extrapolate that out on the shortage for revenue implications only, 1 month, if it takes 1 month to hire a driver, once the seat is open, that generates $666,667,000 on an annualized basis. If it takes 2 months for the carrier to fill the units or the driver, that's 1.3. And 3 months, which is just 90 days, which I don't think is too unusual, that revenue opportunity is potentially $2 million. And please note that the revenue numbers do not include hiring and training costs. This is strictly revenue associated with a unit, with a driver. And this leads us to our next poll question. Do you plan to increase your budget for driver health in 2012? I think we'll see a will increase slightly on this, I think.
And Bob, the good news, it looks like everybody is making driver health a priority for 2012. We haven't really gotten anyone that's saying they will decrease this budget, but let me go ahead and share these results so everybody can see them.
Okay. That's very good. Looks like it's about half and half as far as increasing slightly or significantly versus remaining the same. Okay, earlier this month, FMCSA introduced the National Registry for Certified Medical Examiners. And without question, This rule will be a game changer in the driver health and wellness space. Full implementation is set for May of 2014, and at that time, all medical examiners that fail to maintain the required standards specific to truck and bus drivers will not be part of the registry, therefore be disqualified. There will be pressure on the examiners, the carriers, and the drivers to take corrective action if necessary. Obviously, the National Registry is supported by the ATA. We sense this is the next step toward implementing, towards rulemaking that addresses driver fatigue and sleep apnea. With that, I would like to turn the presentation over to Evan and Gary from Sleep Access, our Comdata partner. Evan, Gary?
Thank you, Bob. The driver database actually leads us straight into our final poll question for the group. Have you experienced any driver disqualification from DOT physicians due to any of the following reasons? We'd actually like to even broaden that potentially to say just temporary cards as well for any of those reasons. All right, we have a lot of the results coming in here. We're going to give it just a few more seconds before we share those across. All right, now we're going to be sharing these results with everybody so everybody can see the results. Want to make sure that you keep these answers in mind going forward. It looks like we're having kind of a spread on all the different conditions there. Nobody's highlighting fatigue as of yet, but keep in mind these answers as we go forward here. I'm going to retouch these in just a moment. First, in order to make sure that everybody is on the same page, we want to make sure that everybody understands what exactly sleep apnea is. Sleep apnea is a condition where the person at night, while they're sleeping, for one reason or another, whether it be neurological, whether it be because of the size of the throat or the small airway, for one reason or another, the airway becomes blocked, and that person has to cough or arouse themselves in some form or fashion in order to continue getting oxygen. This is important because it severely fragments the person's ability to get a full night's sleep, and rather than getting continuous sleep and staying in those REM cycles, the person is only getting little minute-to-minute naps. Moving on to the next slide, we see why this is really important. All of those potential factors that we saw on reasons that we're having drivers denied or given temporary cards, all of them are caused actually by having sleep apnea. And that's not to say everyone that has those conditions has sleep apnea, but what we are going to see, along with that new DOT database, the new DOT registry of physicians, is also coming a new handbook on how to screen drivers for sleep apnea and other underlying health conditions. What the FMCSA and Medical Review Board have highlighted is that every one of these conditions, if the driver has them, then they're going to be required to have a sleep test going forward. So though we didn't see anybody saying they're seeing fatigue as one of the reasons that drivers are being disqualified, all those other reasons that you're seeing drivers disqualified will now give a temporary card in order for the driver to get a sleep test. The biggest reason that sleep apnea affects the trucking industry are those last two items. Sleep debt is the accumulation of non-sleep over a long period of time. In other words, after 3 days of only sleeping 2 hours, then you're going to have to sleep really good for a couple days to catch up. Everybody understands that, but what that leads to in the medical terminology is what's referred to as microsleeping. Microsleeps are small episodes throughout the day of anywhere from a half of a second all the way up to 3 to 5 seconds of a loss of consciousness. Now, the driver or the person is fully awake, eyes open. Well, awake is probably a misnomer, but the eyes are open and they are fully functioning at what they were doing ahead of time, but the brain shuts off and the person loses consciousness from anywhere from a half second all the way up to 3 to 5 seconds. It's not such a bad thing if you're sitting on the couch and you go through a microsleep and you forget what happened the last couple of seconds, but if you're behind an 18-wheeler going 65 miles an hour, it tends to be a problem, as you can travel a quarter to a half mile without remembering where you are or having consciousness to make the right decision. This is why we've seen a lot of studies over the last few years here on sleep apnea and its effects in the trucking industry. What we're seeing here are on the screen are a lot of the statistics that have been passed around over the last few years. The FMCSA, the ATRI study, the UPenn study, all of these studies have really highlighted the same kind of numbers. 28 to 30% of the driving force of the trucking industry has sleep apnea in some form or fashion. Why is that significant? Well, that 460% number right below it, drivers are 460% more likely to be involved in a severe crash who have untreated sleep apnea. That number is important because that's actually higher than if the driver was above the legal limit of alcohol consumption behind the wheel if they have untreated sleep apnea. The statistic we really like to highlight, though, throughout all of our discussions is that bottom right one. Sleep apnea is a really treatable condition. It's not a condition that requires getting rid of the driver in total. It's a condition that the driver needs help with to understand what the condition means for him and how to treat it going forward. Now, why does sleep apnea matter? Realistically, let's talk about why you even care about sleep apnea. What we've been seeing is a strong regulatory push from the FMCSA and above them the NTSB to get a regulation on sleep apnea. The NTSB has been hammering on the FMCSA for the better part of a decade now to make a regulation on the issue. What we're seeing with the DOT database changeover is that physicians now have that handbook, and if they don't use the screening protocols for sleep apnea that are suggested by the FMCSA, then it's going to fall back on the physician's own personal liability for having passed the driver when he should have been tested for sleep apnea. Again, we're going to see that part of the implementation take place in the last part of this month. What we're also seeing is a lot of pressure from the Medical Review Board and the NTSB as a whole, not just towards the DOT physician, but towards a final regulation that actually will impact the individual companies themselves. Now, that regulation will not tell the companies where to get the program or how the program needs to run, but what in essence they're driving towards is an educational program from the company aspect to let drivers know that sleep apnea is not a terrible thing. It's something that can be treated, and there is a company program in place in order to treat it. What we're also seeing throughout the industry is a lot of legal pressure. Attorneys are learning that sleep apnea is a kind of a buzzword as far as their cases go, and they're starting to cite it anytime there's an accident. We've seen a lot of cases over the last 2 years here settle for 5 to 10 times what they normally would have settled for because the attorneys were wise enough to just ask the question, do you have a sleep apnea program within your company, and was this driver tested and treated and compliant with their device? Other than that, the other pressure to really get a sleep program moves ahead to the benefits of the sleep program. I'm going to be handing it off now to Gary Kerrigan to talk about the benefits for both the driver and the company in having a sleep program.
Good afternoon, thanks. Why should we treat sleep apnea? What are the driver benefits? Well, they're quite significant. Obviously, you're going to get an increase in metabolism that will help with sleep and rest. Drivers that are treated literally get the first night's sleep they've had in many, many years. So that benefit is extreme. Overall, increased feeling of wellness. That's we see that's a very positive sign of treatment, as well as some weight loss and other things. Obviously, we get potential decrease in blood pressure, diabetes, and other diseases that have plagued the driver with sleep apnea. Obviously, the driver is more alert and rested for daily activities, which is driving. So those are the main points for the driver. Now, what is your benefit as a company? Well, these facts come from companies that have been testing sleep apnea treatments for over 4 years. $550 average per employee saving in healthcare. These are big numbers for you. 55% retention. We just discussed with Bob Turnius what type of driver turnover, what the issues are. A 30% reduction in accidents and a 48% reduction in the cost of accidents. So these are all great benefits for both the driver's health and for the company's well-being. Yeah, thanks. This is a return on investment slide, and it basically takes those numbers I told you, the savings, puts them on an annualized basis. And as you can see from this, from the reduced medical costs, reduced accident, reduced turnover costs, versus what a fully implemented sleep program will cost, is a return of $9,000 return on investment in the first year. And remember, you keep getting those investments year after year after year. So we're finding that companies that have implemented these programs are all really singing the praises for not only their drivers' acceptance and the health benefits, but for their savings on both the accidents cost and turnover cost. Okay, things to look for when getting a sleep apnea program. I'm going to let Evan talk to us about this for a little bit. And
thanks, Gary. One of the things, these are the main points. Whether you're going with the Comdata solution or whether Sleep Access solution, or whether you're going with another partner out in the industry, these are really the things that you need to look for in your sleep health program, regardless of who the carrier or provider is. The first thing is nationwide scope when they talk about their service programs. A lot of the companies out there will say that they're nationwide program or mention that they have nationwide capabilities, but you really need to evaluate what they mean by nationwide. A lot of them will say nationwide, but they mean just 1 or 2 cities here and there. If they cover 15 cities in the country, that's not really a nationwide program. It needs to be able, testing and treatment needs to be able to happen wherever is comfortable for the company and the driver. The second thing to really look out for is that the program works with your existing company's corporate structure and your DOT physicians. You don't want a program that's going to force you to utilize a different DOT or hire on 2 or 3 people to actually work your program. Turnkey is a word that's thrown around today in many circles, and it doesn't always mean turnkey. So you want to make sure that it actually works within your corporate structure as you currently have it. The third thing that you need to look for is an arm's length transaction throughout the entire program. Now, what does arm's length transaction mean as far as sleep apnea programs are concerned? What that really translates into is that the person that's diagnosing the data from the sleep test is not the same person that is selling you the CPAP. That creates a real conflict of interest as far as those borderline cases that they might have sleep apnea, they might not have sleep apnea. What you really want to look for is a provider that segregates the testing side from the treatment side and really keeps both pots away from each other, so that there's no gray areas as far as was that an accurate result. The fourth thing you want to look for is that your program needs to have a fully auditable trail of activity. You need to be able to see in some kind of a centralized form or fashion. You need to be able to check and make sure that the DOT was working according to your parameters as a company. You need to be able to make sure that the driver was tested according to the same parameters, that he was treated, and if he is compliant with treatment. I can't stress the importance of this particular facet enough. This will actually potentially save you a lot of headache when it comes to legal pressure, or even moving forward into the CSA evolution of CSA as it continues to move forward with driver health, pouring into your numbers. What looks like is on the horizon is potentially even sleep apnea compliance scores, potentially affecting that driver health basis. So an auditable program, and one that can report and give you the results that things have happened the way that they're supposed to be happening, is important. Ongoing compliance is a major issue. A lot of firms may tell you that your driver should only be monitored for the first 30 to 90 days. One of the biggest court cases that has settled in the last 12 months happened because the driver was on treatment over a year and decided that he was healthy. He was all of a sudden cured of sleep apnea and didn't need to wear the machine. The court case settled for about 10 times what it should have settled for because he had a CPAP in the back of his truck and hadn't worn it for the last year. So you want to make sure that whatever program you go with is going to have an ongoing compliance solution that can flag any problematic drivers for you so that you can be proactive on the response. The last thing that you want to look for is that the program should be customizable to fit your needs. Watch out for people that will say that they have the magic way to handle a sleep apnea program, or that they're going to come at you with a cookie-cutter approach. Companies are different in the way that they want to handle things, and they're different in the way that they're going to address sleep apnea. Some companies are going to want to be hands-on and schedule every test and every treatment. Other companies are going to really want to leave that to the provider themselves or the DOT physician to take utter control of the whole program. You want to make sure that your sleep provider listens to you, what you want to have done in the sleep program, and can fully customize that program both on the treatment side and on the financial side, billing, to make sure that it fits your company's own wishes and needs. And now, Bob, I'm going to hand it back to you for the summary of the full presentation.
Okay, thank you, Evan and Gary. Well, a few of the major takeaways that we've recorded up on the driver health and wellness session today. First of all, the regulations are impacting every driver and carrier. There's constant change. It's to be expected. All areas of safety, including hours of service, EOBRs, and driver health, are evolving. Second, as Evan just spoke to, take advantage of reliable solutions that help carriers attract and retain drivers. Companies are literally flooding the market with sleep apnea, sleep health type solutions. Study the provider to help you make an informed choice. Finally, get involved. How do you get involved? By accessing the CSA and the SMS websites. I encourage you to make your thoughts and opinions known to the FMCSA and your local political leaders. Finally, Comdata is a trusted independent partner with 40 years of transportation industry experience. Hannah, I'll turn it back to you.
Sure thing. Thank you so much, Bob. Thanks, Evan and Gary, also for your great information and expertise in this area. We've already got some questions lined up, so we're going to go ahead and start taking those. Just to remind everybody out there, if you'd like to ask a question, just open the control panel on the right side of your screen, select the question and answer tab, type your question into the box, hit send. We'll see it on this end and be able to answer any of your questions about driver health or any of the issues that we've talked about today or any of the regulations that we've talked about today. This first question I'm going to send to Gary. Gary, is this a DOT proposal or is it actually a requirement? And I assume we're talking about the sleep health issues here.
Yeah, actually, what Bob reported earlier in his discussion is the DOT Physicians Registry is going to drive the sleep apnea testing because it all starts with a DOT physician. If he flags a driver and says he needs a test, you know, at that point, that's when the process starts. So it is not a rule for FMCSA, but effectively, if your driver is denied a medical card, then it has the same impact upon a company.
Thank you, Gary. Bob, I'm going to ask you to answer this next question. What item has the biggest impact on retaining drivers? And this question is from Veronica. Thank you so much for asking. Great question.
I'm sorry, go ahead. Would you repeat that, please, Hannah?
Sure. What item has the biggest impact on retaining drivers?
Well, outside of the pay structure, I would say that the EOBR, again, if you're talking in a company environment, the EOBR is a big plus. In an owner-operator environment, I don't think the EOBR has that much significance at this point, although carriers, even owner-operator carriers, are now considering asking and demanding that their owner-operators install EOBRs.
Thank you so much, Bob. I'm actually going to take this next question because I think it'll apply to multiple people on the line. Janelle asks if y'all will be getting a copy of the presentation to be able to share with drivers. You will receive a recording of this presentation immediately after. If you'd like additional materials, we'd be glad to share those with you. I have an email address up on the screen right there. Go ahead and just email us what you need, what we can get for you to share with your drivers, and we'll be happy to help you out there. So thank you for asking that. Evan, let me ask you this question. This one is, I think, representative of a lot of the smaller fleets that are on the line. Can these sleep health solutions also apply to smaller fleets as well as the national fleets?
That's a great question. We get that question all the time. One of the unique benefits of our partnership with Comdata and Sleep Access is that we were able to create a sleep program that was fully customizable and fully functioning as well as it does for the large fleet at the same level and quality and relatively the same price for the small fleet. There is just a fraction of a cost difference or a functioning difference in the large fleet program and the small fleet program. So we are able to offer to small fleets the exact same quality and scope of a program that we do on the large scale, no matter what the company size is.
Thanks, Evan. Gary, I have one for you now. The question is from Johnny, and here's the question. If a driver refuses to be tested for sleep apnea, what legal recourse would the company have?
Well, you know, that's a safety issue. You know, it's going to be handled similar to the drug testing. If you refuse to take the drug test, you obviously aren't going to dispatch him. There are some EOCC concerns about drivers that refused and have not been hired. There's actually a case right now in front of the courts. So it's an issue, but you have to make a decision on the health and safety and welfare of your company. Once the DOT physician flags him, that's going to be on the DOT physician to say that it's a requirement to drive. So right now we're not seeing that many issues. Most of the people, that if it's a condition of a medical certificate, then it's a condition of employment.
Thanks, Gary. This next question I'm going to ask Evan to answer. The question is the medical certificate going to start testing for sleep apnea, and will this be mandatory?
Thanks, Hannah. Yeah, what we're starting to see actually already is we're getting notices from a lot of our partners in several different states because the ruling towards the DOT physicians has been finalized. They're waiting to launch it after this DOT registry is launched at the end of this month. Whether they launch that at the end of May or mid-June or whenever they want to actually send out that response, that's still up in the air. But what we're seeing is DOT physicians can read the writing on the wall, and they are already starting to deny drivers based on these sleep apnea qualifications. Whether or not it will be mandatory, well, if the DOT physician is a part of the registry, then it is mandatory or compulsory for him to use those, because one of the parts of being a part of that DOT registry is agreeing as a DOT physician that you will use the following criteria when assessing if a driver is healthy enough to receive his medical card. And to what Gary said, if the DOT flags that he needs a sleep test, then you're going to start to see with the DOT registry the inability for him to go elsewhere and say, well, I need a medical card and not have to take that sleep test because the physician will know that he's gone to this other physician and will use the same screening criteria that other physician used in order to say if he needs a sleep test or not. So realistically, what we're seeing is it is finalized for the DOTs, and we're starting to see a ramp in now, even before the DOT regulation hits, DOT guidance hits, and we're going to start to see that ramp up in the coming months here. After the database is finalized and the announcement is made, then we're going to see even more pressure from DOTs to have drivers tested.
Thank you, Evan. One more for you. Once a driver has been diagnosed with sleep apnea, how is the driver compliant with using his CPAP? And this is from a carrier perspective. So thank you, John, for the great question.
Thanks, John. What we're seeing is that the FMCSA is going to go along the same guidelines that Medicare and Medicaid use for compliance on CPAP treatment. What that translates is into at least 4 hours a night, 70% of the time. They don't highlight how often you need to check that, whether it's going to be weekly or monthly or however they want the reporting to happen. But what they do say is that if the driver ever has, if you do the math, that basically equates to if the driver wears it or doesn't wear the machine 2 nights in a row, on that 3rd night that he doesn't wear it, he's not compliant. So it really gets into the need to have the report from a company perspective on either a weekly or monthly basis to be able to flag the driver was not compliant to be able in driving. If, say, your reporting is only quarterly and you find out that 2 months ago he wasn't compliant for a solid month, you have real legal issues when it comes to the liability on having that driver on the road and having the information available to you but not being able to, not checking yourself. So what we're seeing is that the timing of when the reporting comes in is not being said yet, but it needs to be at least 4 hours a night, 70% of the time is what the regulation is going to say.
Thanks, Evan. I have an interesting one here from Jeff about driver honesty when they're handed their forms to even know if they need to take a sleep test in the first place. Evan and Gary, I'll let you fight over who answers this one. Looks like Gary won. How is driver honesty on these forms an issue? How do you handle it?
Great question. And in the past, that's on the DOT physician's form. The questions were, do you snore? And every driver answered no. And the second question was, do you have sleep apnea? And every driver answered no. The new regs and the new that the DOT physician registry, those doctors will use, is going to be BMI, which is body mass index. And FMCSA was very careful to give the DOT physicians a base guideline to say anybody with a 35 BMI or higher will be tested for sleep apnea. So therefore, the doctors have a base guideline. They can also use other criteria to determine, but the driver won't get to answer questions. It'll be more in line with the physical requirements of the job.
Thank you, Gary. Here's another question about someone who's concerned about driver reactions to implementing another program. Do you have any tips for implementing something like this and making it go over well with drivers?
I think that the best way to approach this is honestly from the education side of things. If the driver is flagged at the DOT and hasn't been prepped that this might be an issue going into his DOT physical or isn't talked to ahead of time, then you might run into more of an adverse reaction. But if he knows that the company has a program and that him being flagged for a sleep test is not going to disqualify him from employment so much as just see about getting him some treatment and making sure that he is under the care that he needs to be under, then you're going to find that he's more likely to have a positive reaction to the sleep test flag versus the negative adverse reaction. So I think education for the employees that you have a program in place and that we have a provider that we go through for this and that basically what to expect if you are flagged. That is important going forward.
Thanks, Evan. Along the same lines, here's a question from Christine about what type of pushback might we see from unions?
Generally, unions and really large non-union fleets are already starting to implement these programs because the driver health benefits and the company liability benefits overwhelmingly pay for the program. So they're actually on the front side of having these programs in place.
Thank you, Gary. Just a couple questions left. Bob, I have one for you about, do I have to be an existing Comdata Fleet customer to take advantage of these sleep health solutions?
Okay, you do not. Comdata obviously would like for you to be a customer to facilitate the overall process, but it's not a requirement to utilize the Sleep Access program.
Great, thank you. We have a couple of questions left. I think some of them may be better answered individually, so don't worry if we didn't get to your question today. We will absolutely follow up with you within the next hour this afternoon. So I'm going to finish up with one question for Evan or Gary. This one goes to Evan. How long does it take to implement a sleep apnea program?
Well, the answer to that is two different answers, really. In order to start the program, what we're going to see is throwing it back to that whole education realm. Generally, what we like to see is at least a 30-day window, because we like to show you, the company, the program. We like to make sure the DOTs see the program and understand how how the system operates. And we also like to work with you in order to get some materials in the hands of the drivers themselves to know that you have a program now, and that next time you go in for your physical, this might be an issue that's flagged for you, but don't worry, that doesn't mean problems. That means that we're going to work with you and get it resolved for you and get you on the proper treatment. As far as how long it takes to work through your entire fleet, typically what we would see is about a 2-year lag time for the existing driver base, because obviously DOT medical cards last a maximum of 2 years. So it really comes to the point of DOT physical and how often the drivers are going into physical. What you're going to see, obviously, a heavier load on the 1-year medical card than you do on the full 2-year card. But you're going to see basically in a full 2-year span your entire fleet, except for new hires, being addressed for sleep apnea. And then, but to start a program, you're going to at least want 30 days, and potentially, as long as the company wants, if you want to set the sites on 60 days, 90 days, whatever you want, then we are flexible with you as far as that goes. But you want to have at least a small ramp-up education window for both the company, DOTs, and the drivers.
Thanks once again to Bob, Evan, and Gary for sharing this great information and taking the time to speak with us this afternoon. I'd also like to thank all of our customers and friends who are on the line for today's webinar. If you have any additional questions or want to continue the conversation about driver health issues, please join us on LinkedIn. Simply search for Comdata under LinkedIn groups to find us, and feel free to post any further questions or driver health tips of your own right there. We'll be monitoring that group all afternoon to stay in touch with you. If you'd like for us to contact you regarding driver health or sleep apnea solutions, enter your name in the question and answers tab right there on your screen, and we'll make sure to follow up with you soon. You can also feel free to contact your Comdata representative or send a note to that email address that's up there on the screen. And again, just want to reiterate that we will send a recording of this webinar to you via email this afternoon. And on behalf of Comdata, I thank you for your participation and time. Thanks a lot, and have a great afternoon.